Adderall, the new drug that makes university students get the best score, the best concentration, and the best high. Just take 2 pills and it'll make you feel great, and it's sold at a great price. Adderall is a prescribed drug, therefore it shouldn't be dangerous, right? It's not all highs when you uncover the dark reality of this powerful drug. How are we so familiar with the word Adderall? An estimated 30% of college students have used Adderall as a study enhancer. But wait, what is Adderall? It is a mixture of amphetamine salts which is a close relative to methamphetamine, also known as meth, developed to treat ADHD patients. So, how does it work? Adderall influences neuroreceptors in the central nervous system, increasing the effects of serotonin and dopamine. Serotonin impacts every part of your body, from your emotions to your motor skills. It is considered a natural mood stabilizer. In fact, it's a chemical that helps with sleeping, eating, and digesting. So, what's the long-term side effects? Consistent release of dopamine and serotonin causes the brain to stop producing them naturally. Therefore, one needs to keep taking more Adderall to get the same effect, which makes it highly addicting. The release of dopamine alters the brain's reward center, making it incompetent to feel pleasure without the amphetamine use over time. The influence of the chemical increases with the quantity ingested every day. After some time, the brain can grow tolerance to the drug, resulting in a need to take more of it to feel the same effects. Okay, if it's so bad, what was the drug initially for? ADHD patients are individuals with dysfunctional dopamine release, and because of this lack, it is theorized that the brain is constantly seeking out stimulants, resulting in the distractibility common seen in ADHD patients. The dopamine and serotonin released by Adderall overcome this deficit, causing heightened focus and decreased distractibility. It also causes the release of norepinephrine, which activates the sympathetic nervous system, initiating an increased blood pressure, blood sugar levels, heart rate, and contractility. This results in moving the blood to the major organs and away from your limbs and digestion. It can help with repetitive learning tasks, but cannot make a difference when it comes to certain cognitive tasks or complex learning techniques. A definitive advantage presented in non-ADHD patients is that the drug is energizing, which results in staying up and alert for a longer period of time to study, for example. This drug is mainly in tablet form, ranging from 5 milligrams to 30 milligrams, depending on the dosage the doctor prescribes, carefully calculated for one person specifically. This means 2 people taking Adderall for the same reasons will not have the same dosage. Therefore, it is strongly unadvised to share. Amphetamine sulfate has many side effects, minor important ones to serious ones that require you to go see the doctor immediately. This medication is very easy to get addicted to, and addiction to this drug causes many negative effects. Adderall is commonly abused for many different reasons, but the effects are sometimes fatal. These effects can be as much physical as they can be psychological. The long-term abuse of this medication can affect the brain, the heart, the cardiovascular system, the liver, the kidneys, and the lungs. The effects of Adderall abuse on these different body parts are all different, but all have in common that they are negative, bad, and unhealthy. Methamphetamine, meth, is similar to Adderall. The only difference is a methyl group on meth, making it cross the blood barrier much faster, so it arrives in much more quantity in the brain, causing it to be more addictive and dangerous. Its side effects are a loss of appetite, a sleeping pattern change, mood swings, hyperthermia, psychotic symptoms, mental health issues like depression and anxiety, confusion, breathing issues, strokes, or coma. We wanted you to understand that amphetamine sulfate have a harsh effect on the brain. Now we know that, even if in the short run it might help to concentrate, it makes the brain overwork. It means that if you take it, it could only provoke oversweating, but the long-term effect can lead to addiction, coma, and psychosis. It has an effect on the brain, but not only that, the heart, the lungs, the liver, and the kidneys will also suffer if Adderall is consumed. Well, not as much as what a meth consumption could cause, but it's close. Maybe students should think about widespreading the study drug and its disturbing resemblance with meth on campuses. But Adderall isn't the only concentration pill that exists. Some of them don't even require medical advice to be bought. Do they have the same effects on us, or are they more friendly?